Erin Kowal. I'm a registered nurse and a massage therapist, licensed massage therapist from Arnold, Missouri. I founded Mother Earth Pillows back in 1995, and you can go to www.motherearthpillows.com to see more about our products. But today I'm going to cover some of the techniques that you can utilize and add to your therapy sessions for your clients, especially with the winter coming on, and we're seeing a lot more of massage being done with geriatric clients and also clients who need rehab. So this is a way that you can work with the client through heat so that it's much more effective. In addition, it feels really good. So the first thing we do, this is the spa boot. This is the larger spa boot. We have two sizes. We have small and large. Quite frankly, you'll see in just a moment that small actually are great for almost about 90% of our clients. The large ones are good for people who actually have heel issues, maybe if they've had surgery on their foot, plantar fasciitis, etc. Or if you have a large client who has a lot of edema of the feet and they have a lot of pain. So the large one is this one right here. The small one is about 3 inches shorter. So the first thing you want to do, and they come in a pair. Inside the pillow is where you're aiming to put the foot. So this one holds the pouches of flax, which can be removed so that this can actually be washed in cold water wash. The inside is flax. This can be heated up in a microwave, or it can be heated up in a hot cabbie. We only endorse one hot cabbie at this time. It's the Elite Hot Cabbie, which heats to 160 to 165 degrees. If it's in too hot of a cabbie, it will actually overheat and not be good for the flax seeds. And 140 degrees is not warm enough. So the first thing you must always do is check the inside with your own hand to make sure that it's not overheated. The inside of the pillows are always hotter than the outside feels. So you might be a little bit deceived. So that's the first thing you do as you're bringing the products to the clients. The next thing you to do for sanitary measures is you slide on a very, very thin. We use a 1 mil poly bag so that the client really doesn't even feel it. If you're using some feet treatment, as far as some special cream, etc., this can be put over it. You never want to put any cream or oil on the surface of the pillow, etc., or on the skin and inside the pillow over it. But that will actually enhance, the heat will help the treatment be enhanced and provide even a more effective treatment. So you saw what I did. I just slid this right over and it goes over easily. You don't have to fit anything. The insides of the pillows are baffled or sewn so that there's pouches so that the flax doesn't all shift down to the ground with gravity. And now is when you start working with your fingers and doing some nice compressions, stretching. Dorsiflexion. And you're using very gentle wave-like compressions. You work slowly through this area. You can be much more specific with your thumbs, working right through the flax. The nice thing is that the heat really enhances the myofascial release in a much more rapid way. So if you're working with adhesions, you're working with impingements, if you're working with congestion, it's a very gentle way to increase range of motion, decrease pain, and a lot more mobility for your clients. So do what you do through this, and you can leave these feet all warm and toasty. The nice thing about these spa boots is there's heat on the top, the sides, and the bottom of the spa boot. So again, they come in 2 different sizes. These are the large. It's a nice size, but it is actually even more effective just to use the small. Even men's large feet up to about the size 10 or 11 can fit into the small very nicely because the foot's up and they end about right here. So the next approach that we're going to work on today, demonstrate today, is working with a hand therapy. So again, we are going to we have smaller ones, hand covers that are disposable. They come 100 in a package. They are 1 mil poly bags. Again, this is actually designed so that the inside is where you put the hand. The outside holds the pouches on both sides. so that you have heat on the top and the bottom. Ask your client to slide their hand in there. So this is very effective for if you work with geriatric patients, if you work with in the hospice setting or hospital setting, if you're working with Alzheimer's patients. So you have a lot of different applications. Also excellent for if you've had a client who comes to you after trigger finger surgery or rotator cuff surgery. It increases the range of motion, it increases the mobility, and decreases the comfort and decreases the laying down of adhesions. So I have Lisa's hands all the way down to the fingertips. So this is nice and warmed. So you start with a very, very gentle compressions. It's nice for self-care at home, just like this. But when you add compressions to it, it actually enhances the depth of the heat penetration. So you want to go all the way down to, you'll feel the bones of the client, the fingers, you'll feel the wrist. You'll take the hand into a very gentle stretch. This is good if you have a hand that is contracted. So you have a lot of different applications. Wonderful for rheumatoid arthritis because heat is very beneficial. It actually soothes the pain and eases the pain, even though there's an inflammatory response with rheumatoid arthritis. It's interesting to note that heat accelerates the white blood cell response. So oftentimes with pain and swelling and inflammation, the heat is the best recourse, the best approach. So this is a way that the client can actually do self-care themselves with massage with their good hand, or have their family members do this. The other way you can do it, if you could stand up at the side of the table for just a minute, hand. Imagine if you had surgery on the palm of your hand, or you have lack of range of motion in your hand. This is excellent also for massage therapists whose hands, whose thumbs are starting to wear out and giving them a lot of pain, becoming very stiff. You could stand to the side of the table, like I am. There we go. And put your hand down right by your hip. Okay. Now lunge forward. There we go, and keep your elbows straight. So what she's doing is stretching out the hand, the palm of her hand. So regardless of where the injury is or the rehabilitation, the constriction is, it's actually going to stretch that. The heat's going to facilitate a greater range of motion and elongate the muscle fibers and do any myofascial release. And she's doing that herself. So this is a stretch that she can do at home. Thank you, Lisa. So again, we have the warm mitts, we have the spa boots, we have the small and large spa boots. You can look at these products at motherearthpillows.com and visit our site and see what else we have for you.